Ray, thank you in particular for all you and Blackstone have done to make this first neighborhood health station a reality. And thank you, Mayor Diossa, for working so hard to bring this first neighborhood health station to Central Falls, and for encouraging us every step of the way. We stand here together today because most people in the United States don't know what a healthcare system looks like. Most Americans have never seen a world in which every single person who lives among us can get treatment when we're sick and can get prevention to keep us well. We've never lived in a place where you can go to the doctor if you're able to, but where your doctor or your doctor's colleagues will come to you if you can't get to the health center. None of us have ever lived in a place where it doesn't matter if you're rich or poor, black or white, whether you speak English or Spanish or another language, whether you walk or take the bus or drive a car, where it doesn't matter whether you have papers or not, whether you can read or not, whether you walk on 2 feet or walk with assistance. We've never seen a place in which everyone matters, in which we look out for everyone, whether they came to the health center this year or not, whether they do what doctors recommend or not, whether they choose to live differently or not. We stand here today with a different vision, a vision of a place in which everyone matters, with a vision of what Reverend Dr. Martin Luther King Jr. called a beloved community. In Central Falls today, we are one team of people taking care of everyone in the city of Central Falls. We are medical assistants, community health coaches, clinicians, dentists, and nurses, and home health workers, physical therapists, social workers, and recovery coaches, and EMTs, and a host of other professionals working together for the people of Central Falls. In public health, we have the ability to make speeches and put up billboards so that everyone knows about what science says about how to live well and live safely. But we don't have the ability to talk to each person or to understand the challenges and opportunities and hopes and dreams of each person as an individual. In clinical medicine, we have the opportunity to meet each person as they are, should they want to come to see us, but we don't have the ability to take care of everyone together, because too many people stay away from doctors and health centers. Public health improves the health of whole communities, but can't help individuals change. Clinical medicine can help listen to individuals, but clinicians can't change the stresses and strains on whole communities. And clinicians can't do anything for people who don't seek out health care. The Central Falls Neighborhood Health Station gives us the ability to bring public health and clinical medicine together, likely for the first time in the nation's history. And for the first time, creates the opportunity for us to build a real healthcare system, a healthcare system that really can help make the people of Central Falls the healthiest people in the state and the healthiest people and the healthiest community in the nation. By working together, we can end adolescent pregnancy in Central Falls. By working together, we can stamp out cigarette smoking in Central Falls. By working together, we can stop HIV in Central Falls. By working together, we can end opiate overdose death and end the scourge of drug and alcohol addiction, which destroys families and our community as it brings our mothers and our fathers, our sisters and brothers, and our children to their early graves. By working together, we can extend life expectancy, reduce infant and maternal mortality, and colon cancer, make death and disability from heart disease and stroke a distant memory. We have the science to do all these things today. But in order to bring these miracles to everyone, we have to work together and touch every person in Central Falls. And that is what we are doing today by making this neighborhood health station a reality. As some of you know, I've been working on the ideas behind the neighborhood health station for my whole professional career. But I have to tell you that I've never seen anything like the spirit of excitement and collaboration that I see here in Central Falls. I've never seen anything like the decency and the commitment and the willingness to step up. It started the day the Department of Health came here to listen at a restaurant up the street called La Casona almost exactly 3 years ago. Once they heard the needs, people volunteered. They came to meetings. They compromised. They worked together. They buried the problems of the past and looked only toward the future. And so together we got it done. Today, we're here to talk about a building, but what's happening in Central Falls is so much more than a building. What's happening in Central Falls is a community, a bunch of incredibly dedicated people who are working their fingers to the bone because they and we all believe that everyone matters. So thank you, Blackstone, for making this happen, and thank you, Central Falls, for stepping up and making everyone matter.